Hi, this is Dr. Scott Sicherer. I'm Associate Editor from the Journal of Allergy and Clinical Immunology, and I'm here today with Professor Stacie Jones from Arkansas Children's Hospital. Stacie, you have 3 articles in the January issue of JACI. There's an article entitled About Care, which is looking at clinical advances in food allergy, at advocacy, and at treatments. And in fact, you have 2 other articles on peanut oral immunotherapy and peanut sublingual immunotherapy. And so I wanted to hear your take on what are some of the promises that oral and sublingual immunotherapy has for our patients, but also, what are the potential pitfalls? Where do we need to go?
Yeah, it's a really exciting time in food allergy and food allergy therapeutics. I think for the first time ever, we have promising therapies that show clinical benefit, and I think that's what these new articles show. But also they're laced with some side effects, both with oral immunotherapy and sublingual immunotherapy. Even though these are very exciting, they've been in relatively small numbers of patients and subjects so far, and we really need to work to expand to a broader population, to more centers, to look for improved dosing with much reduction in side effects and improvement in side effect profiles before we can move on toward licensing through the FDA for these treatments. And I think right now we would still consider these investigational and that these need more work before they should be in the clinical practice.
So quite a few more steps before it gets into
I think so. It's exciting, but we need to keep working.
And one of the key questions that comes up is about desensitization versus tolerance, however you might want to describe tolerance. But what are some of the things the studies now are looking at with the difference between desensitization and tolerance?
Well, I think desensitization has certainly, there have been some benefits with both of these types of therapy, maybe not quite as robust with sublingual immunotherapy as oral immunotherapy, but again, sacrificing side effect profiles with oral immunotherapy where sublingual is much better, showing some protection and possibly protection for an individual out in the world when we can refine those doses. For tolerance, I think the jury is still out. We don't have enough information with oral immunotherapy or with sublingual immunotherapy to know long-lasting effects of this therapy, and if side effect profiles actually may increase or decrease over time.
Or if they're off therapy, how long might there still be a protective factor?
Absolutely.
So I want to hone in on a particular figure in the sublingual immunotherapy study. In that study, there were different doses and there was different length of therapy. Can you just talk us briefly through that figure?
Yeah, essentially there were 2 initial groups. One group was a placebo group during the first year of therapy in sublingual immunotherapy. And the second, these subjects were all randomized either to placebo or to low-dose sublingual immunotherapy. And then after the first year, those that were on placebo were crossed over to active therapy to a higher dose of sublingual. And essentially what was seen in that first year of therapy is that the treatment group had tolerated significantly or were able to consume, I should use my words
word
correctly,
tolerance,
yes, that's not a good
tricky
word. They were able to consume more peanut protein in oral food challenge than when they started or from when compared to the placebos. When that group was then also looked compared to the higher treatment group after their first year of therapy, the more allergen that was delivered by sublingual immunotherapy resulted in an even higher level of food that was consumed. Interestingly, once those groups progressed out from 44 weeks to 68 weeks, so with longer therapy, a higher amount of protein was able to be consumed.
That's interesting. So I definitely encourage our listeners to be readers and to look at your 3 articles, the article that's the review, also this Consortium of Food Allergy Research's sublingual immunotherapy study, as well as the oral immunotherapy study. Thanks for all the great work you're doing.
Absolutely. It's been lots of fun. It's exciting.